Now, the death toll in the cholera outbreak has risen to 24. 23 of those deaths were recorded in Hammanskraal, while one death has been recorded in the Free State. Let's bring in the Health Minister, Dr. Joe Phaahla, for more on this and other developing health stories. Thank you so much for your time, Minister. We do appreciate it. Let's just get an update on what the state of the cholera outbreak is at the moment in Hammanskraal as well as in the Free State.
Well, at the current moment, in terms of Hammanskraal, as your introduction indicated, the number of people who have passed away is 23. And then in the Free State, it's one patient who passed away with a confirmed cholera. However, it's a little bit more complicated in the Hammanskraal area because out of the 23, we only have 7 which are actually laboratory confirmed as cholera. So if you take out 7 out of the 23, so the remaining 16. It's based on the clinical presentation, which was from a clinical presentation, the doctors were able to have believe that it was a typical cholera presentation, but they could not have a laboratory confirmation. And just to quickly explain that, many of those are those who presented before there was any suspicion that it could be cholera. So these are patients who came around Thursday, which was the 18th of May, Friday, Saturday. So it's only when there were big numbers on Sunday the 21st, that the CEO and the clinicians and also the province, then decided that they need to also test for cholera. So that's what complicates. But because clinically, as the picture then evolved into the weekend, the clinical picture was that of cholera. We don't have the advantage of a specimen having been taken in the early cases from the 18th up to the 20th and even early part of the 21st. It's only later on the Sunday, the 21st, that specimens were collected. So that's what complicates. So when we say 23 in the Hammanskraal area, actually in terms of laboratory confirmation, it's only 7. The other 16 is based on clinical presentation.
Yeah, I mean, that's just going to complicate things a little, but we'll just have to wait for the other results to come out. I want to ask you, Minister, in terms of how many people remain critical and how many people are still hospitalized in Hammanskraal because of cholera.
Well, in terms of those who remain in hospital currently, it's just under 80. That's up to this afternoon. We had 79 patients still in hospital. In the Jubilee Hospital itself, all the patients who are still in hospital are in a stable condition. The few who had been more critical, there were 2 who were critical, and the 2, after being seen by a physician specialist from George Mukhari Hospital, those patients were then moved to George Mukhari Hospital in Ga-Rankuwa. So the 79 who remain at Jubilee Hospital are all very stable on various forms of treatment, mainly in terms of rehydration. So there's not really anything to worry about at this stage in terms of the 79 who remain at the Jubilee Hospital. And the 2 who are at George Mukhari, our report is that also they are doing well, although they were admitted in critical condition.
Okay, that's some comforting news. Minister, before we move on to some other pressing issues in the country, I just want to ask, do you know when we are going to be able to get the actual results of the water being tested for cholera in the Hammanskraal area? You, as the Health Department, are you aware of when these results are actually going to be released?
In terms of the Hammanskraal, that's a matter which our colleagues in the water department and also in the Tshwane municipality, would be coming back to us in that respect. What we know, nevertheless, is the fact that there is no argument about the fact that the water which is coming in that area is actually contaminated from the sewer treatment plant, which is supposed to service this area. And that treatment plant is actually overwhelmed by the amount, and it's not being serviced, and it's spilling sewer into the water system, which is supplying the area. So from that point of view, it's really more of just confirming the actual bacteria which is actually confirmed in the water. That's an issue which I'm hoping that working with the colleagues from the water department maybe by Monday we should be able to get clarity in terms of because that shouldn't take too long. I'm hoping that by Monday we should be able to get clarity in that regard.
Okay, fantastic. Sorry, before we move on to other issues, I quickly want to ask you, Minister, if you know how many children died of parts of this 23 died because of cholera, and how many are hospitalized? Do we have the numbers of the actual children?
I do have I've not actually categorized it into various ages. I do have the list of, they did forward to me the list of the people who passed away. So one would be able to, maybe at some stage, one would be able to come back in terms of, I can quickly also just scrolling through the list which has been forwarded, I can see 3 children.
3 children.
Because I've got it on my, I can see a child of 3, another one of 6, and another one of 9. But the vast majority of the deceased are over 50. Most of those who passed away are over 50, but there are 3 children, even below the age of 10. Between that, up to 18. We don't have a lot of, besides the ones who are below the one I've given the 3. The rest of the deceased is one of 22, and then 33. They're all adults, and the majority, the rest of the majority of the deceased are over 50.
Okay, thank you for that update, Minister. Speaking of children, I want to ask you if you are aware of what's happening in the Northwest. We have been seeing pictures circulating of newborn babies that have been placed in cardboard boxes. I don't know how that is acceptable in this day and age. If there's clearly a shortage, that should have been highlighted. But are you aware of this, and what are you going to do about this as the Health Minister?
Well, I got a message yesterday from the MEC alerting me that it has come to his attention that this happened at Mafikeng Hospital, and that he was attending to the matter. But I'm happy that you are indicating that he's also going to be your guest to respond to that. That's totally unacceptable. It's totally unacceptable. And the MEC did send a report that he was digging deeper into how this happened, because these are basic equipment which, if there was a shortage and I mean, if it was an unanticipated number of newborns at the time, which is also surprising because at any given time in the labor ward, the attending midwives and doctors would know how many babies are being expected, and if they would be able to have an indication if there might be a shortage in terms of all the necessary equipment, and if so, they would be able to indicate to the district manager, so that if it's a situation where they are not able to necessarily procure additional equipment, but they could be able to source even from neighboring clinics and other health facilities. But I'm sure the MEC, as he digs deeper into why the lapse, to me, it looks more like just poor management for those who were managing the facility. And I'm sure the MEC, as the accounting authority in that area, will be able. This is really, it's not a matter which needs a lot of debate. It's really a simple managerial issue at the facility level and including at the district level, which those who are responsible for this needs to be taken into account, because it's really a sign of very poor management in that area.
Certainly. I think you're right. We will obviously have to get a response from the MEC, but I just hope, Minister, we've seen this play out many times before, where the nurse on duty or whoever was on duty is going to be blamed for this. But you might find that oftentimes, and I've covered many health stories where nurses have indicated that they are struggling with resources, and they have highlighted this to the powers that be, for example, the MEC or whoever it might be, that there are serious shortages, there are serious issues within the public hospitals. And, just as the Minister of Health nationally having to deal with all of this, are you aware of these shortages? Do you understand what is actually going on in these public hospitals? I don't know what the side of the nurse is and why these babies were put into these boxes, but oftentimes nurses are put into very difficult positions.
Well, indeed, the fact that our public health facilities are overstretched across the board in terms of resources, from a human resource, many of them work under very trying conditions in terms of the number of health professionals, it be doctors, nurses, and other allied health workers, and the number of patients they have to attend to. And also in terms of resources, in terms of equipment, consumables, that quite often they are overstressed. So that is the fact that many of them go beyond the call of duty because of the demand for services. And as you would know, it's complicated by a wide variety of issues, especially just in the area of childbirth. But we need to get into this, so I will be, while one is aware of the overall picture, at every time when there are very specific challenges, we do need to dig deeper to understand as to, was this avoidable? If so, what? Because in a situation like this, on the surface, it does look like it's avoidable. But you would know that in terms of the pressure on our health facilities, the area especially of maternity services, childbirth, it's very much under a lot of pressure, because beyond just looking after the residents of the kind of area where the facility is serving, but quite often, especially in this area of service, there are also a number of people who simply just pop up, and even in terms of estimating the population being served, is not possible, because many of these also include non-residents. There's a lot of migration, both internally and also quite significantly across our borders. A number of hospitals, especially in Limpopo and also in Gauteng, have been in a number of hospitals where they will tell you that up to 50% and sometimes even up to 60% of the clients who they have to service for maternity services are undocumented. And therefore, even in terms of predicting how many people may come for service at any particular time, it's very difficult to plan. But we need to get, we can't just assume. We need to get deeper into an incident like this so that we can understand and be able to see going forward, notwithstanding the pressure. But some of these trends, we know those trends, and despite the fact that budgets are also, very limited, see how we can avoid incidents like this because they are not acceptable.
Certainly not acceptable and definitely avoidable, Minister. Just lastly, I want to speak to you about the issue around nurse shortages. We've recently seen the public hospitals coming out and saying that this is a crisis that is looming and there is a desperate need for additional nurses. What are you doing to address this crisis?
We have, on a number of occasions, raised the issue with our colleagues in the other side of government, especially at the Treasury level. We have even submitted the numbers in all the provinces were asked before the Minister of Finance passed the budget in February, and we did an assessment with the colleagues in various provinces, and they did provide us with the numbers which we shared with our colleagues in the National Treasury. We just in terms of the immediate basic need, we did indicate that across the board, in terms of immediate, we need an amount of just under R1 billion, about 950 million rand, which is required just to be able to make sure that we can meet the basic needs, just in terms of nurses. I'm not even including other healthcare workers. So that is the matter which we have been, engaging with the colleagues at the Treasury to try and see if they could be able to find additional resources for us so that we can be able to mitigate against this shortage. So it's not something which we are oblivious of. It's a matter which we are taking up with our colleagues who manage the resources of the country.
Yes. Are you engaging, though, with private sector, Minister? Because we do know that, for example, Netcare has indicated that they are willing to participate in an agreement and arrangement with yourselves to train nurses, a certain amount of nurses each year. But they've indicated some reluctance from the National Health Department. Are you engaging with the private sector on how you can both work together in training these nurses?
In the area of to can train nurses. So the shortage which I've just alluded to, it's not because of the fact that there are no nurses who have been trained. I know that there is also a discussion around the fact that many of nurses, many of them will be retired, those who are in the service currently will be reaching retirement age, and there's a concern that we are not training enough in terms of replacing those who will very soon be taking retirement. But currently, the amount of just under R1 billion, which I've indicated that we have tabled to our National Treasury to seek assistance, this is in terms of nurses who, if we are able to have that financial resource, we will be able to employ because they are available, they have been trained. There are many of them some of whom have been also on contract at the height of COVID, when we had just an additional 2 billion rand at the height of COVID. And in the last financial year, that had been reduced to 1 billion rand. So as that money of the conditional grant for COVID of just over 2 billion, which had been allocated to deal with COVID, that had allowed various provinces to then be able to contract additional nurses and various other health professionals. So that amount which we are looking for It's actually, if we were to get that available, we would be able to employ. So there's two issues. One is where we do have nurses who are available, but we don't have the necessary funds to be able to employ them. But there's an expectation, also an estimation that if we don't train more, there are many who will be retiring, and that's a matter which we're working on, and that's why we did not oppose the question of private training also from the private hospital groups.
Okay, fantastic. Thank you so much for your time this evening, Minister. We do appreciate you answering all our questions, and we'll obviously be following up with you with regards to what is happening in Hammanskraal. That was Health Minister Dr. Joe Phaahla.